Now, in the Affordable Care Act, there are at least 4 areas that specifically relate to chronic disease conditions. And we'll talk about respiratory in a moment, but I think we need to look at the overview first. First of all, there's the hospital readmission reduction program. And we're all aware of that. It's been in place. This is the 3rd year now. And hospitals under this program are going to be penalized if they have excessive readmissions within 30 days of discharge for the top 3 conditions that were first launched. That's in congestive heart failure, acute MI, and pneumonia. And we recognized over 2,000 hospitals in the first year were penalized anywhere up to 1% of their total annual Medicare payments. That's a significant shortfall in cash. Right. There is no bonus for having an abnormally low readmission rate. You're just going to be penalized if it's too high. Now, in terms of the value-based purchasing, that's the second element of this new payment methodology. And that's where hospitals are going to be rewarded or penalized based upon how well they adhere to certain core measures that Medicare establishes are consistent with evidence-based medical practice for those conditions. And indeed, under the value-based purchasing, when we saw the hospital readmission reduction program for congestive heart failure, acute MI, and pneumonia, there were performance core measures for those 3 under the value-based purchasing. And several hospitals, several thousand hospitals, did very well in having those core measures in place when patients were treated and actually got a bonus. At the end of the year, they're getting 1%, up to 1% above and beyond what they were normally paid. At the same time, those hospitals who did not measure up to those core measures and who probably also had a high readmission rate were penalized up to 1% of their Medicare money being taken away.